Welcome to another edition of COVID Conversations. We're joined with three very special guests here today. We've got Britton Kenny, who's the Assistant Health Director at Gaston County Public Health. We have Dr. Tia Robertson, who's the Medical Director for Gaston County Public Health. And we're joined with Chad Brown, one of the Gaston County Commissioners, and he's going to be playing a very special role in today's episode. I'm going to turn it over now to Britton and Dr. Robertson, and they're going to be asking some questions of Commissioner Brown, and we're going to have a little bit of fun with some fact and fiction about COVID.
Thank you, Adam. So first, we wanted to start out by answering some of the questions we got in this week after our first episode. And we thought it might be nice to start out by asking the questions of Commissioner Brown, seeing what you've heard on the street, what you're reading about, and then we have our medical director, our expert here, and myself to jump in and talk through some of the fact and fiction around these questions. You ready to get started?
Yes, ma'am. Let's do it.
Thank you. So one of our first questions, someone wrote in about they're questioning the effectiveness of masks and saying there are no peer-reviewed studies that show masks are effective in slowing the spread of COVID-19. Are you aware of any resources that say otherwise?
I've seen on the internet. I mean, is that not what we're after? I mean, social media told me that masks didn't work. So I say that, and I'm a non-masker as far as mandates, but I want to make sure, tell me more about why somebody should wear a mask.
All right. Well, that's an excellent question. And I have two answers for you. So the first is, yes, there are peer-reviewed publications regarding the effectiveness of mask wearing and its ability to prevent the community spread of infection. The American Medical Association publishes a peer-reviewed journal, and there's an article that was dated in March 2021 that talks about how effective the masks are in preventing infection. This article also references several other studies about the effectiveness of mask wearing during this pandemic and how beneficial it's been. So I'd like to answer the second part with, what does that mean? Like wearing a mask, how does that really, why are we so pressed about it? Why do we want everyone to wear a mask? So I'd like to think about it in this way. So you remember when you were a kid and you'll take a mirror, you may like blow hot air on it or something like that, it fog up and you're write something on it, I see you or whatever you want to come up with.
I used to do it at school. I used to put a little heart to my girlfriend in the bathroom. Is that what you're talking about?
That's exactly what I'm talking about. And guess what? You were touching your respiratory droplets, right? Some of those droplets are bigger than others. Some are smaller than others. When you're speaking to someone, everyone has that friend that when they get really close, then you can just kind of feel all this stuff flying in your face when they're talking because they get so excited. Those are respiratory droplets, right? If someone sneezes, what do you do?
I say, salut.
Okay, that's good. That's good. Well, what do you want them to do if they sneeze?
Cover their mouth.
Why?
Because I don't want none of that snot on me.
Exactly. Now, when someone sneezes, you don't necessarily think they have a virus, right? You just don't want their stuff on you. And that's the same thing with the COVID vaccine, the COVID virus, is that when we're speaking, when we're talking, when we're singing our favorite rock anthem or anything like that, guess what? All those respiratory droplets are getting into the air. Some are bigger than others, some are smaller than others. But when we wear a mask, the mask prevents those respiratory droplets from spreading to other people. So it's the same thing as someone sneezing, and you don't want it to get on you. Well, if someone's talking, you don't want the same stuff to get on you. And that helps prevent the spread of the virus.
Well, I guess my other question is, Dr. Fauci says wear a mask, doesn't wear a mask. I get what you just told me, and I understand that sometimes I don't want to get the yucky stuff all over me. How prevalent is that in the air after if I say I'm not wearing a mask? I understand if I'm close to somebody, but if I'm standing this distance away, should I still wear a mask?
So when you're at least 6 feet away, studies have shown that the respiratory droplets they don't spread much beyond 6 feet in general, okay? So we're talking about generalizations, meaning an average, if you will. And because of that, the recommendation is for us to be spaced that far apart. When we wear a mask, it's another layer to protect us from spreading the virus, whether we're 6 feet apart or 3 feet apart. So when we're thinking about ending this pandemic, the way that we end it is by breaking the chain, breaking the transmission of the virus from one person to another. And whatever we can do to mitigate or discontinue that transmission is something that we need to work towards doing, because the thing is that when you think about, like, Britton and I, if we like lock elbows or touch elbows right here, right, and she has the virus, and Chad, if you come over and you touch my elbow, and we're all like touching elbows like this, right, and this virus is, let's say Britton has the virus, right, and I have a mask on my elbow or something, I'm wearing a mask, that virus can't come to me, right, and so it doesn't pass.
Oh,
But
so what you're telling me is when I go to the buffet and they have that little thing in front of there, and I don't want to spit, that's what that's for, so I don't get it on the food. The same way I don't want to get the mask, I don't want to get it on another person. Is that what you're trying to say?
Correct. Because with the virus, it lives in people, and it has to travel from one person to the next, right?
But it's not 100% though, correct?
What do you mean 100%?
The mask wearing, it's not 100%. I mean, we still get it, right, if you have the mask on?
Well, there isn't any data to say that the mask is 100%
But is there data that says
protective.
it's not? There you go. Now
I think that's such a good question, because I think what a lot of people ask about is when things don't work. And what we want to talk about is a layered approach. You know, masking are one piece of the puzzle. Being outside as much as possible is one piece of the puzzle. Getting vaccinated is one piece of the puzzle. Making sure that you're staying home if you're sick is one piece. And so while none of those are 100%, vaccines, which are highly effective, are not 100%. If we layer those all on top of each other, we're going to do a much better job of preventing the spread.
Someone tells me science changes daily. Is that because they're learning stuff every day, or is it just because we're still talking about the science book that I had when I was in school?
Well, I hope we're not still talking about that science book.
Well, I did fail science, just in case you wanted to know.
I wonder if Pluto was still a planet in that science book. But no, there's new data being published every day. We are constantly learning more and more about this virus each day, and we're publishing more information that's dynamic, meaning that if something changes, it changes because we have more information about it. So, you know, it could be really confusing to the public, because you learn one thing one day and then the CDC may say something the next day. And it's not that what was reported on day one is inaccurate, it's just that we have more information, and we just have to move forward with the information that we have at the present time.
Can I ask you a question along that line?
Yes.
So I know one of the biggest questions, concerns that we've had sort of recently was, you know, basically everyone who was vaccinated was sort of told we could take our masks off. And then within a few weeks, a couple months later, there was some other research that came out that was like, oh, hold up, you know, with the Delta variant, there's a lot more virus than we realized in vaccinated people. We need to put the masks back on. So could you kind of dig into that a little bit and help explain that? Because I know that concerned a lot of people, why we were being told one thing one day, it seems like, and then one thing another day.
That's an excellent question. So there are variants that develop with any virus. And with our COVID strand, the original strand there was a variant that became very worrisome because it was so highly transmissible, and that's the Delta variant. So when the mandate was released, when the CDC decided that it was safe enough for people who are vaccinated to not wear masks indoors, that is because at that time, the Delta variant was not very prevalent in the United States. That was in May of 2021. The Delta variant in California at that time was probably about 5% of the COVID cases. The Delta variant rapidly began to take over in terms of being the most prominent Delta strand. And by June, it was already about greater than 90% of the cases in California, and then that kind of spread all the way across the United States. So once we have something new that comes up in the pandemic, then we have to reassess our current policies and recommendations. And that's essentially what happened. As more and more people were being infected with the Delta virus, then the concern was that, wait a second, we have more people who, may have been vaccinated, who are vaccinated and wearing masks or not wearing masks indoors, and we want to protect everybody from this Delta variant because it adds a different layer to the pandemic and the concern. And so the CDC recommended that we all wear masks indoors, because what we're learning is that sometimes you can become infected with the virus if you're vaccinated. Those are called breakthrough cases, and we don't want those who are vaccinated, who aren't symptomatic, who aren't being hospitalized, who are not dying, to pass this virus on to people who are unvaccinated. And so we wanted to make sure that everyone was participating in the efforts to stop the spread of the virus by wearing a mask.
I know we're talking about masks, but I want to ask you a question just because some question just came up as you started talking about it. I get the question as, we're taking the same test that we did for the COVID-19 for the Delta variant. So you're telling me that maybe you guys are seeing something that's changed in it other than the spread, maybe under a microscope or something, there's differences of what's happening to why this is actually called the Delta variant, because we're still using the same swab technique. Tell me a little more about that, because people are telling me it's the same test, how they get two different variants.
So on a webinar this week, so the state tries to give us as much of this information as they can, because we know we're going to get these questions from the public. So something that they'd shared with us this week, they are constantly testing those tests. So, making sure that they're working. They have laboratories that are built to test the test and make sure that they're going to capture whatever the variant is. They were very optimistic that the tests that we've been using are still able to catch and show when somebody has the Delta variant, just like with the Alpha variant and the other variants that have come around. Now, could that change when there's a new variant? Absolutely, and they'll need to continue testing those and making sure that those are working too. But maybe one other thing to add, there's been some questions about the tests being 100%. Just like with everything, people want that test to always work. And we do see some people who test negative and do end up coming back positive, or have a negative test result on one type of test and then have a positive result. Do you think there's any information there we could share with folks to kind of make them confident that that's still a strategy we should be using?
Absolutely. So the most accurate test is the PCR test, and that test takes a couple of days to result. But if you go into your CVS or you get a home test or something, a lot of those tests are rapid tests. And if you are symptomatic, meaning you have a cough, headache, runny nose, a fever, body aches, any of those symptoms that we relate to COVID, and you take a rapid test, and it's negative, then you're going to need to get the PCR test. Okay, because that PCR test is the gold standard for testing, and there's a possibility you may have had a false negative if you are symptomatic and you got a rapid test. And that's the reason why you'll need to get a repeat test. And you may have had your doctor say, okay, it was negative, but you have that fever, so I'm going to go ahead and they may even just write you out of work because they feel like you have COVID at that point in time, and send off that test for the PCR reading to see what that comes back as. And lots of times that's positive. So you may have a negative rapid, but a positive PCR test. And that positive PCR test is the one that's the most accurate, and we will consider you a positive for COVID-19 at that point in time.
I know you talk about two different tests. And, say I feel sick today. Is it okay if I go get that test at the CVS or the health department or a quick drive-through? Or do I need to have a doctor's note to get the PCR test?
That's an excellent question. So we recommend that if you think you've been exposed, to get tested 3 to 5 days after the exposure. If you start developing symptoms, please move forward and get tested. You can go to your most accessible place, because people are getting tested a lot more frequently now. We're finding that appointments may be more difficult to come by, and so we want you just to get the first test that you can get your hands on, and speak to your primary care physician if you get a negative test, if you get a rapid, because then you will need to do a PCR test at that point in time.
My friend, he had COVID, and I went over to deliver some food to him a couple of days ago. Now I feel bad should I just take it straight to the emergency room? Should I just go there first? Is that where I should go? Like I should just drive right in and say, hey, I just want to know?
So, like Dr. Robertson was saying, we have a lot of testing options here. Some people are going to urgent cares. We don't want you to go to the emergency room because our hospitals are really busy right now. And you could potentially be exposed to something else there or COVID there if you're not infected. So a few strategies, and I'll tell you kind of personally, I've been through this recently. We had an exposure and I had to get all 3 of my children tested, and I couldn't find a test close to where we live. So we ended up coming to Gaston County and went through the Contegra drive-through, and they were fabulous. We got a rapid test on them because they were symptomatic, and then we got antigen tests on them. PCR tests on them. So we got the rapid test and the PCR test, and then got those results 2 days later. And just to share, their rapid tests were negative, and then one of their PCR tests came back positive. So we were kind of one of those stories of where, thank goodness, we waited on the PCR test results and weren't exposing people with the positive, thinking that the rapid test was effective. But to answer your question, we have a lot of resources listed on GastonSaves.com, and we're trying to add more and more every day. We have a new testing option that has recently opened up at First United Methodist Church, and we can share some information later in this video about that. Is that okay?
Well, let me ask you, Brenton, you've talked about a lot of things. Let's recap real quick because I'm a slow learner. I want to make sure you guys are right. So what you're telling me is when I go to a mirror and the steam that comes off, that is the spittle in which we're talking about, or the transformation of what's happening. That if I had the disease or the COVID, whichever variant, we have 2 different variants that we know of. Delta's running rampant. COVID-19, the first variant, may not be. So I know the spread is going rapid, but I don't want to get the rapid test if I'm negative. If I go get the rapid test, I can go to different places. I don't want to go to the emergency room. I want to go to urgent care or somewhere that's available, which on GastonSaves.com you said is there. So I see that. I want to make sure that if I'm a negative and I still have symptoms, you're saying to go get that PCR. Tell me more about why the PCR, what it's going to do, and how long will I be out of work if I go and I get a positive result?
Right, those are excellent questions. So the PCR is more of a DNA-based test, and so it's going to identify your the COVID virus, which is called SARS-CoV-2. It will identify that better, and so it's more accurate. And that's the reason why you want to get that PCR test. If you are symptomatic with any of those symptoms, headache, fever, runny nose, head cold, a lot of people are complaining of head colds, then you definitely need to stay away from people, all right? Because we don't want you to spread it. So
and
you want to
do that if
quarantine
you had the
yourself.
flu or any other type of sickness. You'd stay away from people, correct?
Exactly.
So that's why you told me to do that earlier when I told you I had the sniffles. You said stay away from people. I get it now.
Exactly, right. So we want you to stay away from people in quarantine until you get your results back. If your results are from your PCR testing are negative, then great. You don't have to quarantine yourself anymore. You can get back into the world. However, you do need to see your physician or your primary care provider if you're sick, because if you test negative for COVID, the rapid test and the PCR test, you may have something else going on. So you want to get evaluated either way.
Will you write me a note to my supervisor so they know, hey, I'm negative now, so they know I could come back to work? Is that something that's available?
So also from experience and from what I know, because we have a call center that gets a lot of these questions, the public, they want their kids back in school, they want to get back to work, and I felt the same way when my kids were exposed. Most of the tests that you can get, whether they're at CVS or through a drive-through, are going to be delivered directly to your phone. So you can click on a link and go to a My Chart. You can click on a link and it'll show you a PDF of the negative result or a positive result. And then if they are positive, someone's going to follow up with you directly. So for example, after my child got her positive result, later that day a nurse called and kind of explained what that meant and what we needed to do to keep other people safe. So all that to say, yes, you will get some sort of document that you can share with your workplace.
We've talked about masks, we've talked about vaccinations. I need to know, I want to know fact or fiction. If I get the vaccinations, or the booster or whatever I may need, I'm going to get sick from that, right? That's a fact.
Actually, Chad, that's a fiction. What? Yes.
Sorry.
Yes. So when you get the vaccine, your immune system is responding. And when it responds, sometimes you may feel a bit fatigue, a little headache, some muscle soreness, or maybe even a little mild fever. But it only lasts for 24 hours, maybe a little longer than that. And afterwards, you feel much better and you just move on with your day and your life. There isn't a way for you to actually get COVID-19 through the vaccine. That's not possible.
So somebody has to actually give me the COVID before I can actually receive it. In other words, I can't get it from just a shot that's boosting my immune system.
Right. The shot does not have the virus to, it does not transmit the virus to you, and you won't get sick with COVID. You know, and that's a common question. People think, man, I felt so bad after that shot. I think I had COVID, because you think, well, all the symptoms are kind of similar. Maybe I have COVID, but that's not the case. I can share my story after I got my second shot. I thought it was almost the worst day of my adult life, because it felt really bad. I was really tired. I had chills, had a little body ache. But I also anticipated that this could happen, and it did. But, you know, after 24 hours, I felt great. I went and ran a 5K.
What about some of the people who have, I know it's either, you know, you have different brands, Moderna, Pfizer, that are having 2 shots compared to the Johnson 1 shot. Should somebody feel different after each shot if they got one that's a 2 shot, or is it just going to be both shots make people feel bad? Or, because I'm thinking, if I'm a fact man and you're a fiction lady, my thing is, I think, hey, both shots, they hurt. That's a fact.
So can we talk a little bit about why people feel bad after shots? Because I think there's some confusion. Like, people are like, well, if I didn't get the virus, why do I feel like I'm getting sick?
Right. It's just your immune system working. That's all it is. And if you don't feel sick, it doesn't mean your immune system is not working. It's just how your body responds to the vaccine.
I think some of the things I was exposed to as a kid, I'll never get COVID, but never know. One thing I want to ask is, a lot of people are talking about is, well, let's go fact or fiction with this vaccine. One is one shot is better than the other. How do I tell people about which one I want to give? If I want to go to you and I say, hey, can you recommend the shot, or should I just pick one of the 3 that I like?
My recommendation is to get the one that's available. If the Moderna vaccine is available, get that one. If the Johnson & Johnson vaccine is available, get that one.
People have been talking about blood clots with Johnson & Johnson. Thank you. Tell me more. Is this a fact or a fiction that blood clots are being caused by the Johnson & Johnson vaccine?
So this is actually a good question. There have been some studies to say that there may be a correlation between the blood clots and the Johnson & Johnson vaccine, but it's like 1 in a million, okay? So it's very, very, very unlikely to happen.
Okay, so I got to ask the magic question. This is another fact or fiction. 1 in a million. We know one in this room got the Johnson. Oh, that was me. When does the blood clots come? Is it going to come like tomorrow? Is it long term? Is it within the first 5 days? What? Because I don't know. I don't want a blood clot, but I want to know, how do I prepare my mind mentally if I did get the Johnson, because people have talked about it.
Right. So really, like 1 to 2 months, you may develop it, but it's very unlikely. And the studies that show that we call it retroactive studies when we look at people who actually develop blood clots after getting the Johnson & Johnson vaccine. They were mostly women who were in their 40s or less than 40 years old, and it happened, I believe, like 28 to 36 days afterwards. So again, that was 1 in a million. And those aren't large numbers. With most vaccines or any medication that gets FDA approved, you're going to have some adverse effects or side effects. And as long as those are really, really, really small, the numbers are really small, it's still considered to be safe and effective. And so the vaccine is still very safe and very effective.
And I was just going to jump in and kind of what we were talking about earlier. This is why we're so lucky. We've got 3 vaccines to choose from. Like, we're very lucky here. And having talked to some women who are of those ages that had a heightened risk, they chose Moderna or Pfizer because of that. They talked with their physician. And so we're really lucky that we have options. So even though that is a very, very rare side effect, they did their research and were able to land on something that made them more comfortable.
All right, this is my part of fact or fiction. We can play it out later. Fact or fiction, once I say I go and I get the Moderna or I get a Johnson & Johnson or the Pfizer, how long before I can get the booster before I'm available to get the booster? Is there a time limit there?
I'll start and you jump in. So boosters are what everyone's wanting to know about. So we have some people who are still a little bit worried about the vaccine, and then we have other people who are calling every day because they're ready for their booster. So probably a lot of people have heard there's sort of a magic date that's been circled that around September 20th, we're planning for our country to be ready to start giving folks boosters. They've not decided what that looks like and whether it will be an 8-month window, which is what we've heard more about. So anyone who had gotten their second dose more than 8 months ago would be eligible to get their booster. So we're talking about, your booster comes 8 months later. There's also been talk of a 6-month window. So we could have a lot of folks becoming eligible at one time. And unfortunately, we just don't know what that's going to look like yet. But I will tell you, we are doing a lot of preparation on the public health end to get ready for it.
All right, my last question. I just got the Johnson & Johnson. Now this booster's available, or I got the Pfizer and the booster's available. Can I go and get mixed match of a Johnson and a Pfizer, a Johnson and Moderna, or a Pfizer and a Johnson? How does that work?
So we actually don't have guidance on the boosters yet, but from early information that's being released and the way that they are talking about the extra doses for those who are immunocompromised, probably you've heard that some people are being encouraged to get an extra dose of the vaccine now if they're immunocompromised or have certain conditions that make them less likely to have had that really good immune response from just the first 2 doses. The guidance there has been for them to stick with the vaccine that they got the first time. If that's not available, they are able to get a different vaccine. So for example, if you're somewhere where they don't have any Moderna available and you got Moderna the first time, they are able to get Pfizer. But they're encouraging people to stick with what they got the first time. So as of right now, we would probably guess that that's what they're going to say for the booster. But there's a lot of decisions that have to be made about that.
All right, I have another question. I'm all about some questions because I want to make sure that everybody has the goods of what they need to know. Thank you so much, Doctor, for coming out. Thank you, Britton. I just need to know, did we rush to get this vaccination in people's hands and to us? Because usually, we've heard 10 years, 7 years, whatever, and all of a sudden this came about. Did we rush to get a vaccination?
So you're saying it's fact, and I'm going to say that it's fiction and use the word expedite.
So when you say expedite, you mean this was such a global pandemic that everybody jumped in with all forces to make it happen quicker.
Exactly. So when we look at how vaccines are developed, typically it may take years because there needs to be funding. So in order to run these studies and to staff the scientists and the laboratories, you need money to do it. And you need the staff. So you need educated people with the appropriate amount of expertise to work on the different types of vaccines and everything along that nature. So when this pandemic hit, it's a pandemic, and I want people to understand what that means. That means it's across the entire globe. So because it was so devastating, as a global community, all the best and brightest scientists came together to work on vaccines to help prevent the spread of the virus. When you have so many bright and brilliant people working on a vaccine, you can work through that process a lot quicker, okay? And with any type of clinical trial, you have different phases. You have your preclinical trial phase, phase 1, phase 2, phase 3. And with those different phases, with preclinical, you're using mainly like just the basic science stuff. But as you go through the phases, you're including more and more people until you get to like tens of thousands, hundreds of thousands of people in that third clinical phase. And yes, recruitment for those clinical trials may take time when you're just looking at something random, or not necessarily random, but just, your general clinical trial for a different drug you're trying to get through, and you already are anticipating it's going to take about 5 or 7 years to get processed because you don't have anything pressing right there that's a global pandemic. When you have a global pandemic, you're able to recruit people much quicker into your studies. That takes away some of the time. You're able to get the funding you need more expeditiously. That shortens the time. The only thing that you cannot expedite in this process is the years, following up on these patients. So whenever a medication or a vaccine gets approved by the FDA, after it gets through the phase 3 and phase 4, what the FDA does is it monitors the side effects thereafter, right? And that's essentially what's going on now. This is the largest study, essentially, with over 2 million people having received the vaccine at this point in time. If there was something extremely wrong with this vaccine, we would know at this point. So you can't. So with getting vaccines developed, you can account for the money, because we got money, right, to sponsor the research. You can account for the personnel. You have the brightest and the most brilliant people in the world working on this, right? And then there's time. There's an element, and I'm just being completely honest, there is an element of time that you cannot recreate, right? A year is going to be a year. 2 months would be 2 months. You can't expedite that. However, once you're able to account for those other two things, my question to you would be, how much time do you need before you can believe the results? Right now, we have 2 million people who have been vaccinated. 200 million people. 200 million people have been vaccinated. And we have seen that this vaccine is safe and effective in preventing the spread of COVID-19. So I understand the concern that, people are worried that this vaccine was developed way too quickly. But you also have to remember, we're in the 21st century. Technology has advanced significantly. It's not going to take us 5 to 7 years as it did back in 1980s to create a vaccine when we have all the resources we need. We can expedite this process much quicker when we're working together as a community. And that brings me to my next point, that when we're working together as a community, we can get a lot of things done much quicker. So if we all come together and we wear a mask, we stay 6 feet apart, we wash our hands, and we get vaccinated, we can get through this pandemic much quicker.
Thank you guys for tuning in to the Gaston County Ask All. One of the things we brought Dr. Robinson and Britton in for is because we want them to educate you. We're not telling you whether you need to go out and be mandated to get vaxxed or you need to do this. We're simply trying to educate you on the questions that you may have that we're trying to answer. So if you have questions, you can email me at chad.brown@gastongov.com. I'll ask the questions to the experts. Every week we're going to do this so that we take care of your questions and we get you more informed, Gaston County.
All right, so we're sitting down with Britton Kenny, the Assistant Health Director, and she's going to give us an update on the key metrics. That's something that we're doing every week on this show. And Britton, where do we stand right now in terms of the average daily new cases from last week?
So last week, we were averaging about 190 cases each day.
So we're talking about 190 cases on average each day last week. Where does that compare to where we've been?
So unfortunately, that is up again from the week before. The week ending on August 26th, we're averaging 176 cases each day. And the week before that, we're only averaging 138 cases each day. So that's a number that's continuing to climb.
And we're getting pretty close to what we saw as the peak back in January, right, in terms of the average of daily new cases.
We're still, if we continue trending the way we are in a couple weeks, we'll be right back where we were in January.
Yeah. In terms of, one of the things that gets talked about a lot, obviously, is deaths. Where were we with deaths last week?
Last week we had 8 deaths for the week, and there were 8 the week before that also. So, and that number, unfortunately, when we see case numbers as high as we've seen, that number's only going to go up.
Gotcha. Do we know at this point kind of where we were with hospitalizations?
So last week we were averaging 128 hospitalizations daily, which was up from the week before that. We were looking at about 122 the week before that. So that's another metric that we have watched continue to climb over the past few weeks.
And when we're talking about hospitalizations, that's not only Caramont, but that's the atrium system as well, right?
Yes, exactly. That is all of the patients who are currently housed at Caramont, because that's certainly something we're watching, the strain on our local hospital system. And it also includes Gaston County residents who are over at Atrium.
Got it.
We are looking at our percent of positive tests coming back very high. It was 18.7% last week. And you might remember we really want to see that under 5%, which we had reached earlier this summer. And
Right.
that number has just continued to climb and climb along with these cases and hospitalizations.
And anecdotally, I mean, we're seeing a large number of people going out and getting tested in terms of, different partners that we have in the community, whether it's Contegra or different folks are having to test a large number of residents now.
Absolutely. Contegra shared this morning they have maximized their testing. They're testing more people than they ever have before and are still seeing 20% of those come back positive, which is a very, very high number of tests coming back positive.
Absolutely.
One other metric we've looked at the past couple weeks with school back in is our pediatric cases, and we are continuing to see more and more of our cases being made up of those under 18. Last week, we were at just about 27% of all cases being those pediatric cases. So we're seeing a lot of spread there.
And that's a number I know the data analyst in the health department's been tracking that for a while now, and it seems like that share of the overall cases for the pediatric cases is continuing to climb.
Exactly, and we'll probably continue to do so with schools back. Schools are doing the very best they can to make sure children are masked up and staying socially distant, but it's just one of those things we can't have a lot of children around each other without there being that risk of spread. And when schools are back, that means activities are back. So children are getting, it's not just being spread through schools. We're seeing it in daycares. We're seeing it in after-school activities, churches that are back. Anywhere there are people, you have COVID.
And it seems like, unfortunately, you wouldn't want this to be the case, but there's almost seemingly an interesting case study when you look at what Gaston County schools and most of the schools here in Gaston County did with requiring masks versus what you're seeing over in Union County. A very similar population in terms of the number of kids and number of residents, and they're seeing it kind of run wild through their schools.
They really are, and that's one of the things we talked about early on. If we can't keep children masked and away from each other and practicing all of those preventive measures in schools, we're not going to be able to keep them in the schools. And so we're so pleased with all the work our school system and our other schools here have done to make it as safe as possible so children could continue to be in person.
Absolutely.
Thanks, Adam.